Hello everyone, we are now going to go over the peripheral blood flow cytometry from a 55-year-old man with absolute lymphocytosis and lymphadenopathy. So this is CD45 versus site scatter, which is what we usually see first. And here we can see that lymphocytes comprise majority of the cells in the peripheral blood. Here it is like 75%, and these express bright CD45 and low site scatter. And monocytes account for 3% of all cells, and they have similar CD45 like that of lymphocytes, and they have low slightly higher site scatter than the lymphocytes, and the granulocytes, which are painted in orange here, are 11% of all cells, and they have the highest site scatter due to their granularity, and they have dimmer CD45 than monocytes and lymphocytes. There is essentially nothing in the blast kit. Now, when we follow these lymphocytes, we see that it is composed of both B and T cells. The B cells are CD19 positive, and they are painted in maroon here. And the T cells, which are CD5 positive, are here, painted blue. Now, the B cells express a slightly dim CD5 expression in a small subset, and that is usually normal in peripheral blood, nothing to panic. As long as they are polyclonal, you're fine. And similarly, they have like a slight spray of 23, which is okay. FMC7 is positive. They have CD200, all normal. And when we see the T cells, they're 5 positive, negative for 23, negative for FMC7, and negative for CD200. There's a small population here that is negative for 19 and negative for 5, and they are in the lymphocyte gate. They could probably be NK cells, or they could be just contamination from the other gates, like some monocytes creeping in there. We'll keep looking and see what they are. And when we go to the kappa lambda tubes, we see that the B cells are nicely polyclonal. We see 1:1% here almost, or 2:1% kappa lambda. So that is normal. And then when we go to the next tube, which is the T cell tube, here the lymphocytes are all painted in green and in blue. So the green ones are the CD3 positive cells, so the T cells. And then we have some cells here that are CD3 and 7 negative. So those are B cells, and there are some cells that are CD3 negative and CD7 positive, so those are probably the NK cells. And when we look at CD3, we see that there is a large subset of the population that is negative for CD7. So normally in a T cells, we expect CD7 to be positive, and there is usually a small subset of CD4 positive T cells that are normally in circulation and in skin or in other peripheral organs that are negative for CD7. Those are reactive T cells. That is normal, but not to this extent. Here, only 3% of the T cells express CD7, and majority of the T cells do not express CD7, and that is clearly abnormal. And one other thing, if you notice, is the T cells that express CD7 have actually brighter CD3 than these cells. So let's call these as aberrant T cells. So our aberrant T cells also express dimmer than normal CD3 expression. Both populations are positive for CD5. And actually, our CD7 positive normal CD3 expressing T cells are basically CD8 positive cells. And our aberrant population is all CD4 positive T cells. So now we know that this is clearly, I mean, CD4 positive, just because they are CD4 positive, we cannot call them monoclonal, they are monotypic, but at least we know that it is like kind of monotypic, and we think it's a neoplastic process. CD2 is positive in all the T cells. Now we have additional tubes, and we see that our aberrant T cell population is negative for 16 and 56. We have some NK cells that are expressing 16 and 56 here. And our T cells express aberrant T cells express CD2, and they also are positive for CD25 partially. So that is a specific marker for something. We'll discuss that. They are negative for CD117. So CD25 is positive in the T regulatory cells, if you remember, and CD25 and FOXP3 are positive in those cells, if you remember, in T cell maturation, when the CD4 positive T cells come out into the peripheral lymphoid tissues. They have 4 subsets, T helper 1, T helper 2, T helper 17, and Treg cells. And CD25 is positive on Treg cells. And these Treg cells are the normal counterparts of the adult T cell leukemia lymphoma neoplastic T cells. So this is where Atll originates from. So that's why they carry that immunophenotype forward and are and positive CD25 is suggestive that this is Atll. But for positive CD25 can rarely be seen in other neoplastic T cells, so we cannot just put a label on it just by that, but it's an indication. So the final diagnosis on this case turned out to be adult T cell leukemia lymphoma. But when we report our flow, we will just say aberrant CD4 positive T cell population identified, and we'll give the percentage of those CD4 positive T cells, and we'll explain what aberrancies that we saw. In this case, it is dimmer CD3 and loss of CD7. And if you see Atll in general, they have bright CD45 and they have dimmer surface CD3, and very rarely CD3 can even be negative. And CD7 is the most common marker that is lost, and not only in Atll, in many of the peripheral T cell lymphomas, CD7 is the one that is most commonly lost. Similarly, in Atll, CD7 is lost, and most cases are positive for CD2. They are now most cases are CD4 restricted. Some are very rarely, some are CD8 restricted, and very, very rarely they can be double positive. And they do not express NK cell markers like 16, 56, and 57. And 38 and HLA-DR can sometimes be positive. So if you see 38 HLA-DR and no surface CD3, that can be confusing, but this is a mature T cell lymphoma, so you won't see any expression of immaturity markers. And in Atll, there can sometimes be large cell transformation, and these transformed large cells usually express CD30. So some labs add additional tubes with CD30 along with CD25, and they see if there is a population that expresses CD30. But there are different school of thought. Some feel that flow cytometry is not the mode of assessment for CD30 expression or large cell transformation. It has to be performed on tissues, but some labs do it. So we do not have a uniform consensus on that, but that's one other thing that that can be done, and you can keep that in mind. Thank you.